Is the overall health of Americans improving or is it declining? We'll discuss this issue on Talking with Henrietta, coming up next. Hi, I'm Henrietta. Welcome to the show. We have probably all heard about the growing rates of obesity, diabetes, and other health problems that were not widespread health challenges a decade ago. So with all of our modern medicine, is the overall health of the American public getting better or is it worsening? And what are some of the simple health steps we can all take that are within easy reach? On this show, I have 3 guests who will share their knowledge, insight, and experiences. On my far left is Kirsten Wheeler, the Program Director for the Institute at the Golden Gate, a nonprofit partner to the National Park Service. Seated next to her is Dr. Michael Stephen Norris, who is the President-elect of the San Mateo County Medical Association. And seated on my far right is Anna Ruiz, who is the Assistant General Manager of the Mid-Peninsula Regional Open Space District. I'd also like to acknowledge the members who are in the studio audience. Well, thank you so much for joining me.
Thank you.
You heard me talk about the growing rates of obesity and also of diabetes. So, do you think the overall health of the American public is getting better, or are we getting worse and worse?
I think there's 2 ways to look at it. One way is to look at the life expectancy of Americans has been extended, as we all have relatives now living into their 80s, 90s, and beyond. So on one level, we feel that people's health is improving. Yet when you look at some of the things that you mentioned, such as diabetes and obesity, if you look at a map of the United States, say 15, 20 years ago, on the percentage of states where the majority of individuals were obese, it was a very small number. Now you look at the same map nowadays, and certain blocks in the South, for instance, and other parts of the country are now very, very heavily populated by obese individuals, that being measured by a body mass index greater than 30.
So, Kirsten, the people who you deal with, what would you say in terms of their overall health, as far as you can tell?
Right. Well, I would definitely agree that it's an interesting thing to look at. Our life expectancy is increasing, but the quality of life that we have, I think, is actually decreased. So I believe that there's also a health equity issue that we're facing, which is much greater now than it even has been in the past. And that's really dictated also through the economics of where our healthcare costs are actually coming from. There's a statistic that I read about a year ago from the Centers for Disease Control that actually states that 15% of our population across the country accounts for closer to 80% of all healthcare costs. And so I think that's really indicative of, while maybe some people's health is getting better, that equity in that gap is definitely increasing, I believe. And we're seeing that some of the most vulnerable populations are actually getting worse due to many of the social determinants of health, which I'm sure we'll talk about today.
Yes, we'll get to them. And Anna, would you have something to add in terms of social equity, obesity?
Well, you know, for Mid-Peninsula Regional Open Space District, one of the things that we're looking at is expanding our outreach and our ability to bring more people out into our open space preserves, bringing people of different walks of life, different age groups, and expanding our programs, offering more interpretive activities, more family-friendly activities to really encourage people and their families to come out to enjoy the open space preserves. It's a great opportunity to be out in nature and be physical all at once.
Well, you're probably getting a little bit ahead of So I'm just wondering, in terms of the overall health, maybe those people who go out on walks that you lead, or that you've seen others at the district lead, what would you have any comments in terms of their health?
You know, when people are out in the open space preserves, it's a very interesting experience that one has. You're out there and you're physical. You're walking, you're hiking, you're jogging, you're maybe on a bicycle. So you're physically active, and at the same time you're out in nature. And there's an amazing calming and stress relieving ability that brings to one, that brings a lot of health of mind and health of body. And it's great for stress relieving, it's great for physical activity.
So, you know, Anna is kind of reminding me that it could very well be that people who are out in the open doors anyway are probably far more health conscious and would not necessarily be representative of some of the people who are having health problems.
Well,
no.
What I was thinking when Anna was talking was that the people she describes, it's sort of like the old cliche of preaching to the choir.
Yes.
And
yes.
so the people who are out in the open spaces are the people that are experiencing the pleasures that she describes, and they are experiencing the health benefits, where the people that we would like to reach by expanding these programs are the people who are more sedentary, who are at home with young children playing video games constantly, older people glued to the TV set and Fox News, and the working population who are tied down to their desk during their day and tied down to their Barco lounger at night. So that's the group that Anna's trying to reach, and we're trying to reach.
Well, you know, I heard just earlier this week that sitting all day, for the most part, which is what happens in the workplace, is just as injurious to your health as smoking. And so that comes as an eye-opener, just in terms of the damaging effects. It's like the more you sit, you can start taking years off of your life.
Yeah, there was an article that was printed today in the New York Times that says if you just take your lunch break, so on average we get 30 minutes for our lunch break. Obviously it's a little bit different for everybody. And if you took those 30 minutes and you just walked, you could actually add on about 10 years to your life for what you're doing. And so, you know, ever since the Industrial Revolution, we've definitely changed the way that we work. And we are definitely more chained to the desk, so to speak, some more than others. And it makes it much harder, I think, for people to get outside, to get those benefits of moving. But I think even just beyond that workplace setting, there's a lot more barriers. It's very complex why people aren't spending more time outside, especially when we're talking about more vulnerable populations and communities. There's a lot of different pieces at play of why they might not be spending time outside.
So maybe let's get into those pieces. But since we did talk about people being at their desk, I would just like to add, you know, people are now encouraged to stand up at least once an hour at their desk. So there is a little hope if you're chained to your desk.
Right.
So why aren't people, do you think, Anna, not getting out more to enjoy the outdoors? To maybe get into some of your programs?
You know, I think sometimes a lot of the digital media can sometimes be a little bit of a barrier, in that people get glued into their mobile devices and don't have an opportunity to kind of step away. And we've seen that as one barrier, and we've taken that on as part of our programs. We have a geocaching program where you can come out with your smartphone or with a GPS unit to go out and explore the open space preserves, going out for the purpose of being outdoors, but then also going out and finding treasures in the open spaces. And so people bring in the digital media, and hopefully we're bringing more people out and encouraging more use.
You know, that's a very interesting twist on things, because when you started, I was almost thinking that it would be beneficial for people to leave their digital media turned off while they're enjoying the outdoors. So it's like they're still tied to it.
They're very much tied, and we know that, and I think it's going to be very difficult for some people to really let that go. And so we're trying to incorporate some of that media into the actual enjoyment of the land and the physical activity. And so we also have special guided hikes that you can download our interpretive information and go out for a hike. And you're out there, you're being physical, you're taking a walk, and you're learning about the nature that's around you.
So the Healthy People's Initiative that you're a part of, Kristen, what is it? Healthy
Parks, Healthy People.
Healthy People.
HPHP makes it a little bit easier as well.
Would that encourage people to use their digital media when they're outdoors?
It's a little bit different. So the Healthy Parks, Healthy People movement actually started in 1999 from our good friends down under in Australia. And it was started actually as a marketing campaign. So they said, well, we've got to figure out a way to get people outside. We know...
Even in Australia?
Even in Australia. And their programs actually focus on new arrivals. So they work with immigrant populations. And they realized that there was a lot of community resilience issues when new arrivals were coming to Melbourne, Australia in particular. And they didn't feel very connected to their communities or connected to that space. Because we all know that it's very important for people to have a sense of place. There's a lot that's built from that. Those positive memories are very important. So they started that program as a way to introduce new audiences to their parks. And one of the biggest things they had to overcome was their naturalists and park staff were more used to engaging kangaroos than people. So they actually had to look at it as a way for their staff to get more upskilled in how do we actually engage these populations.
And I'm thinking engaging kangaroos, you're not walking, taking them on tours or
yeah, but their naturalists were much more, you know, in line with how do we preserve kangaroos in the natural space. But now it's
keeping people away.
Exactly. So we have to remember that these protected spaces are, they have intrinsic value. We want to keep them for the health benefits of our people.
So stay a little bit more in terms of the Healthy Parks, Healthy People, because it's a national initiative, isn't it?
It's an international. So there's 35 countries that have adopted Healthy Parks, Healthy People in the last 10 or so years. It came to the United States in about 2008 from the National Park Service. The director of the National Park Service made Healthy Parks, Healthy People one of the biggest calls to action. So there's a set of initiatives that the National Park Service rolls out and makes very important. And they saw it in two different ways. They said, our parks really are only going to exist if we can make sure that we have a generation who is around to protect them. And what we've been seeing actually is this year, 2014, this last year, was the first year in the last 20 years we've been able to actually increase visitorship to the national parks.
That's amazing.
Yeah.
We'll get back to that.
So, yeah, so once it was adopted in the United States, the National Park Service kind of brought us on board here in the Bay Area. We all know that the Bay Area has always been an area for innovation. It's a hub of innovation. A lot of great ideas come out of it from Silicon Valley all the way into San Francisco and the way that they run their public health system.
So we'll talk more about it. In the meantime, Dr. Norris, you are involved in Walking with Doctors? What is that about?
Well, this is a program that originated in Ohio several years ago, I think about 15 years ago. A cardiologist in Ohio found it helpful. He himself was an avid walker, and he started taking patients of his with him on these walks. And he termed it Walk with a Doc. And when they would walk, they would be exercising, but they could also have a dialogue as to any medical questions and any topics that they wanted to breach with the doctor. And that program has expanded all over the country. And in San Mateo County, we have a Walk with a Doc program that has, and last year, for instance, we went to 16 occasions at parks all over San Mateo County. This year we're going to go to 30 occasions, including, we're now partnering with the open space districts, so that's going to open up a broad experience for these people. Rather than just urban parks, we're going to be up and down the hills.
How long, when one walks with the doc, how long is the walk?
Well, we try to do it for the population that's there, whoever shows up. So we'll usually have sometimes one doctor, sometimes 3 doctors. and sometimes we'll split up into different groups based on the group's activity level. So sometimes you have older, slower people. Sometimes you have rabbits. So we try to, space people out, and then we'll walk perhaps a mile, depending on the terrain. Take a break, talk a bit, get water break, snacks, and then we'll walk another mile or so. So I'd say the average walk has been about 2 miles.
So the emphasis thus far has been on walking, and I'm sure that's something that you're very much involved in.
Yes, very much so. And as the doctor had mentioned, we are partnering with the San Mateo County Medical Association, and we have 6 walks that we have scheduled that will be occurring this year. The first one's starting in March. It's a very exciting program for us to be partnering on, and we're hoping that we'll have great attendance at these walks.
And is that in partnering, is that walking with a doctor?
Yes, yes. Yes, we will be having doctors there and joining the walks and being present, and folks who will be attending can ask questions, medical questions, and general questions, and they'll have an opportunity to speak.
About how many people can be accommodated?
Well, I would yield to Alice. I don't think there's a maximum. I'd say our groups usually range from as few as 5 or 6 to as many as 20.
So the emphasis thus far has been on walking. Why?
Well, because it's natural, it's easy, and it permits a dialogue. As you are walking, you can engage in conversation. It's a little bit more difficult with jogging and some other activities to carry on a conversation.
And what else are some of the benefits? It's my understanding that running can be very hard on the joints.
Well, I know as a former runner, and let me emphasize former, that it is hard on the joints, and that's why I don't run anymore. We do have some of our members who are avid cyclist runners, but when they show up for the walk with the doctor, they're walkers. Their input is useful, however, because they know all about various physiology of muscle stretching, and they can pass that on to the people who come for these, I call it a seminar, because it is really an educational event.
Educational events, healthy parks, healthy people, an educational event.
Well, for us, one of the reasons that we've gravitated towards calling our Healthy Parks, Healthy People programs, that we call them walks versus, let's say, hiking or running or jogging, is that our target population is actually those served by the public health system. So we partner with public health departments in all 9 Barry counties, including the park agencies that serve in those counties. So that's everything from state to national to city parks. So it's a really great, diverse amount of agencies involved in the initiative. And the first thing that we did was we talked about, well, who are the people not coming to the parks right now? Who's not already reaping the benefits of spending time outside? And it was very much the same population that's spending a lot of their time walking through the clinic doors of the public health system. So we had a very easy way to cross over right there.
And how would you describe that population?
So the population is typically more underserved, vulnerable, in communities that sometimes also have access issues to safe parks. So one of the first places that we launched a park prescriptions program, where we actually now have doctors prescribing time in parks for their patients as they would a heart disease pill. Obviously it doesn't take away those life-saving pills, but it is really an added bonus and a preventative health resource.
So before you continue, it's very interesting you talk about those who are underserved, those who may not have access to the parks. What role would diet play? Because I'm thinking they could very well not have access to the parks, but then at the same time have a good diet. Now, of course, one doesn't make up for the other.
Right, and I would say that the majority of the communities that we specifically work in are also in areas where there's a large food desert. And for those who are not aware of that term, it often means, similar to not having access to parks, you don't actually have access to affordable and healthy food. So that might mean that their closest area to get food for dinner that night would be a convenience store. And I think many of us know what you find in a convenience store. Not exactly the full diet that you would require to stay healthy.
So there are no prescriptions with the Mid-Peninsula Regional Open Space District as far as food, right?
No, no. And you know, one of the great benefits about the open space preserves is they're free. They're free to the public. They're open 365 days of the year, sunrise to sunset, and we have trails of all different for all different abilities. We have trails that are flat, where we can bring strollers, wheelchairs, people with physical disabilities. We have trails that are a little more moderate for those who are seeking a little bit more strenuous activity, to trails that are much steeper and much longer. So they're there for everyone.
7 days a week?
7 days a week.
No, there have been a lot of mountain lion sightings. Do you give any lessons in terms of what animals people might run into? And
there's all sorts of different animals, and mountain lions certainly are there. That's part of their habitat, but they are extremely rare, a rare sighting. In fact, we have rangers on staff who've been with us for many years who have never seen one. So when you see one, it's an incredibly rare instance. But we have deer, we have wild turkeys, we have bobcats. We have all sorts of great animals that you can go out there and take a look at all the time.
It sounds fascinating. We have been talking about an issue of equity. And so how do you see those issues, or that issue, playing out in the Healthy Parks, Healthy People initiative, or in Walking with the Docs, or?
Well, I think Kristen addressed it from her perspective as far as their target population. In San Mateo County, we have as you know, there's a broad spectrum of economic and financial levels of the families, and so that feeds into access to medical care. The recent Affordable Care Act may have helped some people get medical care, but there's still a large population that is underserved. And part of that gets picked up by some of the county health services, but there's a large number of people that are underserved. And those are the people that, from my perspective, will be perhaps difficult for us to reach through these programs, such as Walk with a Doc, without expanding it. I think that by the efforts of our staff to expand it to communities all over the county, I think we'll address some of those people, rather than just going to the tonier neighborhoods of Hillsborough and Atherton, for instance.
And you had mentioned, Kristen, that there is a correlation between the patients who come into the hospital and the patients who are not involved in some of the healthier activities.
Right.
Do you see a growing number of those patients, of those people?
Well, luckily what we're seeing through the Healthy Parks, Healthy People program is that we are starting to see upticks and improvements in health. We're starting to see more people getting involved, and they are the faces of the people that are walking through the public health clinic, and a lot of it has to do with the amazing partnerships that have been created. One of the things that we've been working on the last few years in the Bay Area is actually reframing the way that parks are viewed. So there's a perception out there that parks are viewed as a place for recreation, which is very much true. That's what they're founded in. But I think one thing we forget is that the urban park movement actually started as a public health intervention. Central Park was designed to create an open, safe space for people to get vitamin D, to relax, and get the restorative benefits of spending time outside, as New York was becoming that hustle and bustle and people were starting to get chained to their desks.
And also skyscrapers that blocked a lot of the sunshine and the tall buildings and all of the concrete. Having lived in New York, I can talk about it. I lived right a few blocks from Central Park. So.
Yeah. And as our populations become much more urbanized, we're moving into that across the country. And it's very important for us to not only recognize parks as a public health intervention, but really start to advocate for more and safer parks, better access to them for all.
Now, before we go on to something else, you had mentioned something I thought was very important, and that's the results are beginning to show. How are those results beginning to show? How can they be seen?
Right, everybody wants to see the end result, right?
I mean,
we want
you know,
numbers
how
and
do
data.
you know that decrease in heart medication
Sure.
or high blood pressure medication is coming from
It's a
being
great
in the
question.
outdoors?
So this movement of health and nature, as we call it, has really grown. I would say that it got picked up and became very popular and trendy in 2008. And since then, we've seen a growth in the programs that are focused around health and nature. So that's one way to measure it. I help to run a national initiative with the Centers for Disease Control and the National Recreation and Park Association. We have 35 different experts across the country. We've collected over 50 different programs that actually directly involve healthcare providers asking and telling their patients to spend time outside in parks, and that partnership's been created on the ground. So through those different programs, we're measuring different ways of improvements in health. And as I'm sure the doctor will tell us, it does take a much longer time to
I
start
would
to
think.
actually study. You know, you can't expect to have a doctor say, go spend 60 minutes outside in this park, and then they come back on their next visit and their BMI has changed. That's just not, I wish that it was be a magic pill,
if they
right?
do it every day, by the time of their next visit,
I guess it depends when their next visit is.
But it is human nature, unfortunately, to want, and we've been grilled into thinking that there's going to be an easy fix,
Right.
and there's going to be a pill. As you know, many people on crash diets, they just want a result like that, or they want a treatment, and you hear them on the radio and on the TV. They want to have, instead of exercise, couldn't they have surgery to maybe, I'm a plastic surgeon, so I see some people come in, can't you just cut this away, Doc? One of the responses, couldn't you diet and exercise? Well, they'd rather have surgery than the thought of diet and exercise. But so I think Kristen's data, when it is available, is going to be quite interesting.
And talking about data, is there any data perhaps that the Mid-Peninsula Regional Open Space District might collect in terms of the people who come by, engaged in the programs? Or
We are keeping information on who is signing up, and we're also starting to look at having more detailed information on counts of people actually using our preserves. So that'll really help us have an understanding over the long term on the use, on the patterns, and the visitation overall.
have you seen any increases or decreases?
We've seen increases over time. We have noticed that there are more people out and about, and there's definitely a higher demand for programs, interpretive programs, family programs, our docent-led programs. So it's definitely on the rise.
Well, you know, it just occurred to me with our drought, we might have more good days for people to be out and about. So.
And we've seen that this winter. We've had this winter we've had a lot of use out in the preserves.
Sure. Now, you know, you mentioned, Dr. Norris, being a plastic surgeon. And given the fact that you are a plastic surgeon, how did you become interested, other than perhaps being a doctor, in some of the programs and activities involved with open space and walking?
Well, I've always, for my own personal self, I've always been motivated to exercise. I think anybody who does exercise regularly knows that there's a feeling of well-being. It's physiologic, it's emotional as well. I mean, you feel like you've accomplished something when you are finished with that exercise. So I've been a believer of that for forever. So it was natural for me, when this program was introduced through the Medical Association, to become actively involved in it. And I think I'm getting as much benefit from it as I believe the individuals who show up as the guest, because I enjoy the dialogue with them, and I enjoy the walks myself, and I'm looking forward to going to some of the open space parks this year.
So having a small studio audience gives an opportunity for some questions, for some comments, reflections, observations. So I wonder if there might be anything that the four of you might have in mind to ask or to share.
Hi, I have a question for all of you. So one of the big challenges is getting youth, and in particular, you were talking about vulnerable communities, underserved youth. What are some strategies to actually get youth out in the parks and enjoying it and being active?
I can start.
Okay.
So one of the strategies that we're employing through Healthy Parks, Healthy People is we found that getting healthy is just as important as having actually fun outside, so that's a great point. And we found that one of the things that we're seeing right away as an improvement in people's health, I believe is health, is social cohesion. So we actually work with community leaders, trusted community leaders, programs like the YMCA or Boys and Girls Club who have that source of youth already and bring those groups out together, and they're already with people that they know, and they go outside. And there's a lot of research behind if you can create a positive outdoor wild nature activity experience, they call it, in youth before the age of 11, they're 3 times as likely to actually become an environmental steward as an adult.
What type of activity would that imply?
I personally am biased towards activities where there's not a lot of structure for youth, actually. I think that one thing that we've done in society today is actually made things, we've lost some of that creativity and imagination. And we're seeing prescriptions for children with ADHD to spend time outside written a lot more. That's a huge area where we find that there was a Dr. Ming Ko who actually came out with research last year that said they're starting to be able to equate that 22 minutes of wild nature play. You can take away a dose of Ritalin, which is a game changer. We are over-prescribing ADHD medication, in my opinion, to youth right now, where I remember that I grew up here in the East Bay Hills, and we would just go out and you'd come back before it was dark. And I don't think that exists anymore.
And it seems almost insane to think that recess time in schools
Is decreasing.
Yes, yes.
Right.
I was going to bring that up. Is along the lines of what Kristen was saying, is that it's ironic to watch during the football playoffs and the pro football games, they'll have a commercial for a program that the NFL has sponsored called Play 60. So they have to advertise to tell children to go out and play, which is just such a foreign idea. You'd think play would be so natural for a child instead of having to have a program telling the kids, go outside and play.
Yes.
But that's how things have swung from, you describe your childhood and my childhood to what's being experienced now.
Well, the question was asked of the 3 of you, so I'd certainly want to give the 3 of you an opportunity, each of you, to respond. Was there anything else that you might have want to say in terms of the question?
Well, we were talking about children, and our program, of course, is open to all ages, and we do encourage parents to bring their children with them, and a lot of them do. So we have a spectrum of people who turn out for these, ranging, I'd say, from 8 to 80. And we interact with the children as well. Some of our members are pediatricians, so they can answer childhood-related things, but many of the questions aren't specific to childhood. It's more about diet, exercise, shoes, stretching, topics such as that for the children.
So Anna, you might have some responses in terms of what the Mid-Peninsula Regional Open Space District might be doing, if anything, to engage more young people.
Yes, well, there's a number of things that we're doing. We do offer a variety of docent-led hikes and walks. And in fact, I was looking at it in February, we have over 20 of them. And some of them are geared towards family with small children who go out. They'll go out, they'll be led by a docent, someone who's very knowledgeable about the area. They'll go out and look for tracks that different animals leave behind, scat,
mountain lions,
different signs of animals, and get to know the different plants and at the same time enjoy the landscapes and the views that are there. We've also partnered with College Track, who's bringing out different groups, different students from high schools, local high schools, out to the open space preserves to go out and run and enjoy the land as well.
Is this usually on a Saturday?
It's, I believe it's during the week. It's after school, an after school program.
Ah, so I guess that would really be very much in ongoing when it comes to, if it's after school, more daylight in spring and
Yes.
summer. And
Yes.
So I don't want to have a fixation on the rain since California hasn't had
We don't have
much.
any rain.
But
Yeah, what rain?
what happens in case of rain? You mentioned February.
You know, many of these hikes are still go on, and you know, unless there's a downpour, but a light rain jacket and sometimes an umbrella if you need it. But there's not much that you really do need. Some comfortable walking shoes, a water bottle, maybe a hat, and some sunblock, and you're off. You're off and ready.
Off and ready. Did that answer your question, or maybe there might be something more that could be added?
No, that was great. Thank you.
Yes. Other questions, comments?
Hi, I know Anna said that the Mid-Peninsula Open Space Preserve parks are free to the public. What about the other programs that you all offer? Are they also free at no cost to the community? And at these events, what is the situation for parking?
Good questions. I can start. So we have criteria actually set for Healthy Parks, Healthy People program. And the idea of setting criteria is that we want to make sure that we remove as many barriers as possible for vulnerable populations to get outside for health. So one of those top criteria is the program. If it's sponsored by Healthy Parks, Healthy People, it has to be free. In addition to that, it actually has to be culturally appropriate, which often means that the park staff members speak the same language as the community they're inviting. So we have bilingual and trilingual park staff leading these. It's a very multicultural experience. In addition to that, we make sure that the program is actually introductory. So we do use the word walk, so you don't have to show up and be prepared for a 10-mile hike if it's your first time spending time outside in an open space or preserve or park. So with that criteria, it also makes it really easy and simple for our public health providers to actually prescribe that program, because it's offered at the first Saturday of every month, forever, at the same time, same location. So it's very simple, just like prescribing an ADHD medication would be.
The question also asked in terms of parking. And I know in some parks there is a cost.
Yeah, so when you go to a Healthy Parks, Healthy People program, we actually encourage public transportation, and much of our populations do rely on getting to those parks for that. So we've been working with our park agencies around the Bay Area to actually have them host the programs that are most accessible to the populations in need, so we can actually get rid of that parking fee or just even the hassle of driving.
So can you give an example? Because I was thinking that too. The accommodations that might be made for those who may not have cars, because it's access that can be a very big issue too.
Sure. So that's one of the biggest things that we wrestle with in our Bay Area Collaborative is, you know, how do we make sure that all programs aren't just happening in the beautiful hills, whether that's the Marin Headlands or up in the East Bay Hills, is let's figure out exactly where people can go in Oakland. Let's figure out where you can go near the Western Addition in San Francisco. And for us, that's also tackling community issues. The more you have people actually spending time out in their communities, getting that visibility, spending time together as groups, there's actually proven research to show that community violence and aggression will go down too. So it's really looking at all upstream solutions to figure out how we can make sure everybody's getting healthy.
That's quite interesting. And I'm wondering, Anna, in terms of the parks that the Mid-Peninsula Regional Open Space gives, to which the organization gives access, would parking be a problem, or would there be free transportation, or how accessible are they?
Well, the vast majority of our open space preserves have parking areas available, parking areas with restrooms. And then you have your trailheads, which are basically the entrance trails into the preserves. And generally, we don't have real parking problems.
Free parking?
Free parking, no charge at all. There's also some transit access to some open space preserves, and if anyone is ever interested, they can check our website and we can provide that information to them.
And the website would be?
www.openspace.org.
Oh, that's simple enough, openspace.org. Okay.
Yeah, and you know, our preserves are open and free to the public, and so are our docent-led hikes, and we have many of them. We know that not everyone feels quite as comfortable going out to the preserves on their own, and so this offers an opportunity to go in a group setting with a lead who's very knowledgeable about the area, about what to find, what to expect, and so they can go together in a group with other people and feel comfortable, feel maybe safer in that respect.
So let's say a docent-led hike, how early might it start?
Oh, they vary. Some of them are in the morning, some in the afternoon. And
At 6 in the morning, or?
not quite that early. No, not that quite that early. But they could be as early as 8, 9, 10 in the morning. And we even have some evening hikes. When there's a full moon and there's a good opportunity to be out there, we have docents who are interested in bringing people out at that time.
Oh, that's absolutely something to consider. Any more questions?
Hi, how can I sign up for a walk with a duck?
The best way is to contact the San Mateo County Medical Association, and their website is smcma.org, and there'll be information there on the schedule, and there'll be maps on how to access the various parks, the dates, the times, and you can just sign up on through the website. We also have people just show up. We encourage people to sign up on the website so we get an idea how many people are coming. But there's no restriction, there's no reservation, there's no cost. And as we were talking about, parking's never an issue.
So I'm sorry, did you have another question? Okay. It would be most unlikely sometimes to have someone like the questioner booking a walk with the doctor. You would say, oh, she doesn't look like she needs to have a walk with the doc. Who typically signs up or requests the walk or goes on the walk?
Like I alluded to earlier, some of the people that come are the most fit people you've ever seen. Some of the people that go to the open space are very fit. They're outdoorsy people. And so that's I'd say 30% of the people who come. We have another small group of people who will show up with walkers and other devices. And so they are less fit, but enthusiastic. And then there's the broad middle group, which are your average people who are interested in maybe getting a little more fit, people with medical questions about their cholesterol, about their medications, what have you, and for whatever reason, either because of access issue that you alluded to, or perhaps our modern healthcare system, which curtails time spent with the doctor's office for visits. So this is a real relaxed atmosphere. They can ask anything.
You mentioned people with walkers and other devices. And the question might be, what other devices? And can people show up who might be disabled in wheelchairs?
I don't know that, at least none of the walks that I did last year, I can't recall anyone in a wheelchair, but all of the parks are handicap accessible. And I'm sure with the and I know the open space has certain handicap accessible areas. So we can certainly accommodate anyone. And that's why it's good. We have usually at each walk there's going to be 3 or 4 or more staff people, a few doctors, and we can, like I said, split up into groups and we can gear it for just about
one
any
really
activity.
Doesn't have any excuses. What's the youngest client you might have had?
I don't know if we've had any infants in arms. I'd say we've had the 4 and 5-year-olds out with their mom and dad. We've definitely had that.
And some of the oldest?
I'd say in the 80s, definitely in the 80s, maybe even 90s.
Same for us. Our youngest was 4 months. Our oldest has been 89.
And of course, we know the 4-month didn't come on its own.
No, I think she had a bus pass.
Took public transit.
With a parent.
Right. But I think it's an important question, what types of devices are you seeing, or, assistance are you seeing at that? And that's an area where our parks are starting to grapple with as they promote themselves as health resources. It's also an opportunity for us to really look at, are our park staff actually ready to welcome folks who do have higher health needs? And so that's an area that we're actually working to train our park staff in. One is cultural humility. We don't have to know every single thing about everybody, but we do have to be able to provide a warm and welcoming space for those who might have some handicaps that they're not used to seeing. Traditionally, our parks have been used by a pretty Caucasian population, a population that you know, is going to yoga classes or is walking their dog. And that needs to change if our parks are going to continue to exist and thrive, because our population is changing and we need to make sure that our parks are for everyone forever.
Well, you bring up an interesting topic that I wouldn't necessarily think of in terms of cultural sensitivity. You would think if it's an open park that anybody can walk into it and make the most of it.
And that might be the case, but the perceptions of parks actually in America are very different when you're looking at different ethnic as well as different socioeconomic backgrounds. One of the issues that we've been discussing with folks, especially in the African American community and the Latino community, which we know the Bay Area is extremely diverse and rich in that, is there's a perceived sense of racism in our parks. So when you see a park staff member in a uniform, we've had folks who actually have gone to there and felt very uncomfortable because they associate it with a Border Patrol agent or they associate it with law enforcement. So it doesn't feel like a place for open recreation, but it feels like they're being watched. And so,
are they?
Well, you know, what we're trying to do is actually change that perception, and a piece of what we're doing at these Healthy Parks, Healthy People program is making them multicultural and making sure that our staff members look like the populations that we want to come there, and that's really helped.
Do they have guns?
No, they do not have guns. There are park rangers that exist, and those are specific law enforcement. When it comes to interpretation and docents, they do have first aid kits accessible. They have walkie-talkies so they can get in contact should an emergency occur. And actually just knowing that piece was very important for some of our new park users, because they said, well, what if something happens to my kid and I'm just out there in the Marin Headlands? What happens? Well, when you go on a Healthy Parks, Healthy People walk, you're with somebody who's trained in everything that you know, they need to know, and they know those procedures, and that safety concern kind of dissipates.
Well, I could think that might be a time to pull out the cell phone. Would the cell phone work?
Yeah, exactly. That changes also depending on kind of how deep into that open space preserve or park you've gone.
Kristen brought up some interesting aspects of the parks. For example, the cultural sensitivity and some of the stereotypes and some of the perceptions. Is this something that the Mid-Peninsula Regional Open Space District deals with at all?
Yes, and we've been engaging more in having additional programs and more opportunities for a more diverse audience to come out and be out in nature. We're hosting an African American Heritage Month celebration here coming up in February 21st at Ravenswood.
And I think we might even have a graphic that might illustrate that. So if that can be found, is that it?
Yeah, that's exactly it. And we're hoping that we'll have lots of people coming out. We're going to have both nature and craft activities for children. We're going to have a nature walk. There's a very accessible trail that leads to 2 observation decks, very flat and a hardened surface, so wheelchairs and strollers very accommodates both very easily. And we'll have docents, we'll have people out there talking about the nature, talking about the waterfowl that you see, because it's a really important site for different shorebirds that come through the bay.
And where is this taking place?
This is happening at our Ravenswood Open Space Preserve, which is at the end of Bay Road in the
Cooley Landing Park.
Cooley Landing Park, yes, just outside of city of East Palo Alto.
Yes, and talking about cultural sensitivity and some of the stereotypes, is that anything that might be of a concern for the Walking with the Docs?
No, because so for instance, it's now that we've collaborated with the Open Space Preserve, one of their requests of us is that, as the Medical Society, is that we have doctors and/or staff at the walks who are bilingual, Spanish speaking. So we're expecting and welcoming that population, you know, to join us on these walks.
And talking about Walking with the Doctors, I think we might have a graphic that might illustrate some of those.
Yes.
That would be it, Walking with the Doc.
And as you see, the first one this year will be on March 7th, also at Ravenswood. We were talking about Ravenswood a few minutes ago. Anna was alluding to that. So that's going to be our first, that'll kick off the season. at Ravenswood, and I look forward. I think I'll be there. I don't have a life outside Walk with the Doc, so I'll be there.
Well, you have a very interesting life walking.
I get to see a lot of the county.
So can people, when they're on those walks, can they specify a particular doctor? Or they simply, whatever doctor is available who shows up?
It's more like we're all volunteers. We don't have a rotation or a call schedule for the doctors. So whoever volunteers for that particular day will be the doctor there. It'd be nice if people could select their own doctor or a specific specialty, but that's not always possible. So I try to answer all questions, not just questions related to plastic surgery, though there are quite a few of those where people go, well, what do you think?
Well, if you can ask the doctor anything, I would think, why not, given the specialty of the doctor.
Save a copay, right?
That's right.
So usually, how often do these walks occur? And can people get involved, go on each one of them, and would they be, yes, go on.
I'm sorry to interrupt. We have several people who will follow us from park to park.
I was
all
going
up
to
and down,
ask
all
if
up
that
and
might
down,
happen.
Fan club.
up and down the county. We'll have people show up, on a regular basis because they enjoy it so much. But we have some people who come once, and then you don't see them for a while, and then they come back. But in answer to your original question, it's every week, every Saturday beginning March 7th, except for any certain holiday weekends, and I can't remember if any of the July 4th, if that interferes with the weekend. But otherwise, every Saturday, 10 o'clock at some park.
And how would people find out? Is there a website?
That would be the San Mateo County Medical Association website, which is smcma.org. Oh, I have my T-shirt. It's my Walk with the Doc T-shirt.
And you wear it? Do you wear it
I
when
wear
you're
it
walking?
when I'm walking with the doc. I don't know if the camera can pick it up, and that has the website, smcma.org.
So one can go on that website, smcma.org, find out when the days are, when the times are,
And the place.
and the park.
Yes.
And show up, and it's free of charge, free parking.
And food.
Oh, there's food.
We
I
bring-
want to assume it's healthy food.
Well, it's snacks. It's apples and little cookies and all the water that anybody could park. And we even bring dog biscuits.
Oh, so one can walk with your dog. Oh,
some of the
that's-
parks are dog friendly, yes.
Oh, that's great. Can people bring their dogs, pets on walks?
In certain preserves, they can. We have 7 different open space preserves that are open to dogs. And in fact, we have a Walk with a Dog coming up later this year that is open.
At Windy Hill?
There's one in Windy Hill and there's one in Pulgus Ridge.
Okay.
Are open. And so, yeah, they could bring their
could bring
their
their
pets,
dog.
another member of the family, so they can bring them out.
So it seems that you're taking away the excuses or things that people might have for not participating.
Yeah, and I think if we can create that, first-time positive outdoor experience, what we find through Healthy Parks, Healthy People is that we do get some people who come to every single Saturday program that we offer, and sometimes they get to kind of rotate and experience parks in all 9 counties because they know what to expect. They know there's going to be a staff member to greet them. They know it's going to be warm and welcoming. They know it's going to be free, etc. And so what we really want, though, and what we're starting to see is now people feel empowered to go on their own. So they're going on Wednesday after work with their kids, or they're making the time to go, or they're changing their path that they walk the kids to school and putting a park into that path, which is ultimately what we want, so that they can have that sustained improved health, both mental and physical, better social cohesion within their neighborhood and their families. And I think a huge important piece too for our parks is that, we really need new people to love our parks and care for them.
So what would you say in the time that we have left for someone who says, I'd love to do what you're talking about, but I just don't have time?
That
And
is
I'm sure there
the
are
number one
people-
barrier. There's social research to prove that is the number one thing that people say.
And do you tell them, well, you'll have more time in your life if you join us?
I think that's a piece of it, and I think it's also important to kind of talk them through and break that down, because for some people time is actually, well, I work 3 jobs and I'm a single parent, and that's a big issue. And so for them, it's let's talk about how we can actually get you to spend more time with your family when you're outside together. And for some, it really is, they think they don't have time, but really they do. And so instead of going to that movie, let's spend that hour and a half and go explore something new.
Do you have, what kind of excuses or?
I think the way that the program has now been expanded, I don't think there is any excuse, because it's accessible, it's convenient to all areas of the county, and even outside the county, because we're going to Windy Hill, which is in Santa Clara County, isn't it?
No, actually, that is in San Mateo.
Is that in San Mateo?
It
Okay.
is.
Okay. See, there's my geography. Well, we're going from one end of the county, so as far south as Windy Hill, and as far north as Daly City. So we cover the length and breadth of San Mateo County, and it's every Saturday at 10 a.m. So even hangovers are not an excuse.
But you can't drive under the influence.
That's true.
You'll need to take public transportation, and you'll have to be at least coherent, right? Able to walk.
That's right. we don't serve Bloody Marys. We serve water and apples.
And he did mention Santa Clara County. There are programs, of course, the Mid-Peninsula Regional Open Space District has programs and hikes also in Santa Clara County.
Correct. We have many, and they're scattered. Our district extends from the Los Gatos area all the way to San Carlos. So all across our different preserves, we have different hikes that are available to the public and walks.
In the time that we have left, which isn't much, is there something that you think you'd really like to share that we haven't talked about?
I guess I would just share that our parks are beautiful places for families to come together to get healthy, and at the end of the day to enjoy yourself and to get involved with the Healthy Parks, Healthy People initiative. You can find us at hphpbayarea.org, as well as
hphpbayarea.org.
And you can visit parks in all 9 counties and get healthy with us.
7 days a week, on your own or in a group.
Exactly.
Have we missed anything, Dr. Norris? I'm sure we've missed a lot.
I think one of the real value of our program, as well as what Kristen has alluded to in her program, is it's an outreach, and it's educational. It's not a spoonful of medicine that is hard to take. This is educational. It's fun. And it's comfortable for these people. It's not like going to the doctor.
Well, it's not like going to the doctor, and going to the Mid-Peninsula Regional Open Space Parks is not like going to the doctor either. And so people will have a chance to walk with the doctor and take care, be involved in Healthy Parks, Healthy People initiatives. I'd like to thank the 3 of you for joining me here to talk about where we are in terms of our health and some of the simple steps that we can take to improve it. I'd like to thank the studio audience, and I'd also like to thank you, the viewers, for joining us. Until next time.